HHS will hold a telebriefing with the newly appointed monkeypox response team to share its efforts to contain the virus. As of now, the CDC has confirmed more than 6,600 cases across the U.S. And the quick spread of this virus has officials at the White House now scrambling to play catch up after weeks of logistical delays in providing critical testing, treatments, and vaccines. Joining us right now with the very latest is NBCNews.com senior White House reporter Shannon Pettypiece, and also with us, Dr. Amish Adalja, a senior scholar at the Johns Hopkins Center for Health Security at the Bloomberg School of Public Health. So, Shannon, what can you tell us here about the shortcomings so far and the new approach?
Well, the federal government's really in a race against time here. Right now, this virus is mostly spreading among men who have sex with men. It's a sort of relatively niche group, and there's a sense that if they can keep it sort of isolated in this community, then they have a chance of stopping it and containing it. There's a lot of concern because this virus has spread faster than federal health officials anticipated. And in that time, when it was spreading, going from a few dozen cases to now thousands of cases in the matter of several months, there were a number of setbacks at the federal level when it came to quickly distributing a vaccine and a smallpox treatment that are believed to work in monkeypox patients. And public health officials worry that that has cost them precious time. So now the administration says they're going to be finally shipping out hundreds of thousands of vaccine doses and targeting them at people they believe are the highest risk for infection. So in this instance, the way the virus is spreading right now, that would be men who have sex with men who have multiple partners or people who were exposed or in a close contact. So there's this race to get as many people vaccinated as possible. And at the same time, this communications message to try and urge people who are at high risk to curtail risky behavior, at least in the interim, while they can get more vaccine out there. But of course, in the meantime, there is this concern about a spillover effect that the virus may already be spreading more widely than realized because of a bit of constraints in testing, and that the longer it is out there, the more widely it could spread to other groups, even potentially to children and kids as people return to school. That's some of the worst case scenarios people have out there right now. So as you mentioned, the administration, they're holding a briefing. They've appointed a new monkeypox coordinator who's going to start trying to coordinate and improve efforts as they make this big push to contain this virus.